you must know what the medication is being used for, the purpose for the use of the medication. You must understand that how much to take, when to take this medication, it is very, very important. And what are the possible side effects to have when taking this medication? All these are very, very important, very, very important when you are taking your medication. So, and it's the kind of question you should ask your healthcare provider, especially the pharmacist. So, how what are the possible side effects? How do I take my medications? When to take it and how many to take? These are the possible things that we all need to know as we are taking our medication. So it is very, very important to understand the proper way of taking your medications.
Most doctors, when they prescribe drugs for you, they will still write on the prescription that this is how you should take it. But most often, I think I've not come across a doctor that will just give you a prescription that and it will not give you how to take it. I think it's rare.
I don't know the kind of prescription you've seen, but there is no prescription that any doctor, a licensed doctor, will write without a proper way of taking the medication. It has always been written doctor. So it is that write up that the pharmacists have to interpret. But here now, what we're trying to say now is that no matter what, even though the doctor writes the prescription and the drug is being dispensed, it is your everybody duty, responsibility to ask the questions. Even though the pharmacist will explain, you need to ask the question once and again. How do I take, when to take it, and how to take this medication? It is very, very important. So all prescriptions do come with all this information I mentioned.
Okay, thank you. So what is the danger of self-medication?
Well, danger of self-medication, thanks for that fantastic question. The dangers of self-medications, many people today take drugs without seeing a doctor. This is called self-medication. It may seem harmless, but it can be dangerous. Taking antibiotics, for instance, taking antibiotics without a prescription, it's really dangerous to our health because antibiotics create a lot of resistance. So the resistance in the sense that when you need the medication, they are not really effective to your body or to your health any longer. So because you are taking it, you have been doing self-medication. So self-medication, it's dangerous and it's what is really rampant in our society nowadays. And it is not what we are also preaching for. So you should always consult your healthcare provider before you commence in any treatment. So, and also sharing medications also is another area where we need to. Sharing medication is also as if danger of self-medication as well, because Mama Chinedu went to the hospital last 2 days and they gave him a certain drugs to take based on his own assessment. So now Mama Chinedu now discover this also thing I have to take. No, Mama Chinedu will now pass that certain drugs to Mama Chinedu. It's not done like that. Mama Chinedu also needs to go to the hospital for proper assessment before she commences on that treatment. So self-medication is not really what we are preaching, and it's not what ethically allowed in the healthcare system. So self-medication, it's what we all need to say no to in our society. It is danger. As I said, it might seem harmless, but it can be dangerous. I encourage everyone, before you commence any treatment, try to consult your healthcare provider. They will properly guide you on how and when to take these medications accordingly. Because according to the father of toxicology, the Paracelsus, he said all substances are poisons, but the right to differentiate poison from remedy. All these substances you're seeing, all these drugs you're seeing, they are good. They are good to our head, and for the other hand, don't use them very, very well. They can cause harm to our head. That is why you should consult, especially the pharmacist, before you conduct or commence any treatment when it comes to the drug.
Okay, thank you for that wonderful answer. You are there hearing our voice. It's Health and Safety Half Hour on Armed Forces Radio 107.7 FM. What we are talking about here is how do we manage our health and the benefits of health. In recent time, most times many people they do self-medication.
Mm.
Once they are sick or they even feel headache, instead of them to go to their healthcare provider or go to the hospital, they would prefer to go and buy paracetamol or buy any drugs they just feel like and just take it. Because somebody took it, they get healed, so they feel the same thing. You don't know what the other person is feeling when you take that drugs. Since that drugs healed the person, you went and still buy the same. So what we are trying to say here is try avoid
medication. Do the proper consultation before you commence any medications.
You should regularly, people go for your checkup regularly. I think it's more advisable do your checkup regularly, not once in 7 years or once in 2 years.
Yeah, it is good to do regular checkup. Not prevention is always better than cure, because and it is very, very important that we should know our vitals. So what is your blood pressure? What is it reading? What is your glucose? What is your temperature? What is your heart rate, your sugar level, as I mentioned? So everything, we all need to know all these things. Not sometimes that's a lot of machine at home now that people can use to check, but it doesn't mean they should not also visit the hospital. So regular checkup is very, very important. As I said, prevention is always better than cure. Once you detect it on time, you're able to conquer it accordingly.
That brings us to the next question. How do we store our medication? Most recent time, our mothers, let's just say our mothers in the village, they don't know how to store medication. They just get drugs. After using it, some will even try it in their part of their wrappers, some will keep it. So you just see different place to just keep the medicine, which is not right. So how do we store our medication?
Safe storage is another area that we also need to look into, and we also need to discuss here today, because people nowadays, especially our mothers, you said, many people leave all their drugs in the kitchen. Some might even put it inside there or in the pillow, So, and all these drugs, heat, sunlight, and moisture can eventually damage the medicine and make them less effective or even harmful to our health. If medications or medicines are not properly safe, so they can be dangerous and cause harm or less effective to our health. So in a proper way to save medication are meant to store in a cool, dry place, and we should always check for the expired dates regularly. So maybe you have refilled your drug for the past days and the month and you abandoned it, so you need to check. Definitely, I'm very, very sure that non-pharmacists will dispense an expired medications. However, maybe you kept them at home and after some time the drug expired at home. So you need to check and see whether this drug already expired before you start taking those drugs. And another thing that we need to pay keen attention to, that most people used to practice at home, that is not really good. We don't flush medication down the toilet, please. Don't flush your medication down to the toilet if they already expired or they are not being used again. Don't flush them down the toilet, because this can actually affect the water source and also the aquatic organisms. Is the reason why we always say we should not flush down medication down the toilet. There are proper way to dispose the medications, so you can consult your healthcare provider or the pharmacist on how to properly do that. So safe storage is very, very important. Store drugs in a cool, dry place and take them away from children. You don't save drugs inside the pillow, or you don't keep them in the kitchen and come back after 2 days that, oh, I left it on the gas cooker or on the electric stove. So you don't keep your medication there. As I said, heat and sunlight or moisture can eventually affect the medication and cause them to be less effective and even harmful to our health. Thank you, Mr. P.
We're still on ARMFORCES Radio, and the program is Health and Safety Half Hour. We're still looking at the benefits, managing your health. It's good to know you are still here in case you are just joining up. It's Armed Forces Radio 17.7 FM. The program is Health and Safety Half Hour. How do you maintain your health and how do you stay safe in your environment? Farmer Lukie, please, what is your advice for my audience out there for quality wrap?
Okay, before we wrap it up, permit me to also mention or to say something about this common misconception.
Okay.
Because most people believe taking more medicine will make them heal faster. So like we ensure that we give you a prescription, you take this one tablet or capsule. So people believe like, okay, I will not follow what the doctor or my pharmacist say. I will just take 2 drugs. So they will feel like, okay, taking more drugs, it's more make them heal faster. No, it's not. It isn't. It's not rather. So it's a kind of a misconception, and some people also feel like that. If I feel better, I can stop my medication. So there are some drugs, even though you feel better, like your antibiotics, you still tend to continue with it. So you don't stop antibiotics when you have not completed those. You still need, even though you get better or you feel better, you need to continue and finish the dose, because if you don't do that, it creates a resistance, as I said earlier. And when you need the drug again for that same medication or something similar, it will not really work because the bacteria already create resistance. So the summary to wrap before I leave you today, let's go over the key message or the keynote of this segment. The first thing is know your medications, the type of medication you are giving, and when to use it, and what is it used for. Is it the medication that is being used for headache?
Hello, good evening.
Good evening, sir.
Your name and where you are calling from, please.
Yeah, my name is Anderson and I'm calling from ABUJA, area.
Okay, so what is your contribution or your question?
So I have a question.
Okay.
My question goes like there's this drug that I've been taking for a very long time.
Okay.
Yeah, for a very, very long time, like it's like close to like 10 years or so.
Okay.
And I found out that the drug is no longer active, and I don't know how to go about it.
Hello, good evening.
Good evening.
Your name and where you are calling from?
My name is Comfort Galu.
Comfort Galu. Where are you calling from? Ganiyu. Where are you calling from?
I'm from Abuja.
Okay, Abuja. So, okay, New Yanya, Abuja. So,
Yes.
what is your question or your contribution? Okay. Okay. All right. Thank you very much. Okay. All right. Thank you very much.
Okay, thank you, madam, for your fantastic question. Like what Mr. Peter asked earlier, the food, because I made mention of the drug
Yeah.
to
Related
food interaction or drug to drug interaction. So what we know as grapefruit, so really interact with some of our medication, especially the people that are hypertensive drugs, anti-hypertensive drugs like taking the Lukie, amlodipine, or any of the other anti-hypertensive medications. So grapefruits, it actually affect the absorption of this blood pressure. Then it doesn't allow it to work at all, and if it doesn't allow it to work, definitely your BP will not come down. And also milk, also our dairy, our milk.
This is your quality wrap. And before we go, let me just give you some highlights. Basic things you need to do at home, wherever you are. You need to wash your hands regularly, stay hydrated, get enough sleep, eat balanced diet, please do regular checkup, no self-medication, avoid self-medication, and please try and manage your stress, and please do take a break. Do try and take a break, and For those that called through, I want to say thank you very much, and please do well and join us next week, Monday by 7 o'clock on Armed Forces Radio. The program is Health and Safety Half Hour. This year we call it a wrap. My name remains Promise. Good evening.